Hey everyone, thanks for watching. I've had a lot of requests for a video on hair thinning and hair loss, the causes and the treatments, and I'm going to go over everything today. I'm going to give a lot of information, and this one is specifically for hair thinning and hair loss in women. There are many different causes of thinning hair in women. I'm going to go from the most serious to the least serious. I just want to say I'm not a nurse, I'm not a doctor, and what I learned from going through cosmetology school, learning about the different types of hair loss, and things that I recommend are what the curriculum recommends. And also I was in the medical field years ago, and I have a little bit of a background in medicine. Just as a medical assistant, I had a passion for dermatology. I loved learning skin disorders, scalp disorders. So being a hairstylist now, later on in my life, I see that they go hand in hand with dermatology, skin disorders, and hair. So I think that's pretty neat. So there's different types of alopecia, which is a medical term for hair loss. There is alopecia areata, and that just means it's patchy hair loss. So you'll see little patches here and there. Sometimes the patches overlap. There's also alopecia capitis totalis, and this means that there's a complete loss of the scalp hair all over. It's not in patches. There's alopecia liminalis frontalis, and these are lesions and scales and crusts that form, and it's kind of an acne type of eruption from the scalp that causes permanent baldness and scarring. So some treatments for alopecia would be corticosteroids, which could be in shot form, cream, pill, lotions, foams. Another treatment is a topical immunotherapy. And what that basically is, it's an irritant that they apply to the scalp to induce an allergic reaction. And this, what the allergic reaction does, it stimulates the follicle to try to get it to grow. That's multiple treatments for alopecia. Some cannot be treated. Basically, alopecia is an autoimmune disorder where your body attacks its own hair follicles. So it's a very terrible disease that they still do not have a cure for. There's something else called traction alopecia. Traction alopecia is when you wear ponytails too tight. I'm thinking in particular of a famous young lady who wears big bows in her hair and really tight ponytails. I'm noticing she already has traction alopecia from being pulled too tight. Her hairline was entirely moved back because of this. And unfortunately, this can be permanent. The next type of baldness is called female pattern baldness. And this is a permanent hair loss or a thinning of the hair, and it's basically hereditary. The androgen receptor is on the X chromosome, so it is true, it is passed down from your mother's side. Everybody has their different patterns. Sometimes women start to bald right in the crown area. Sometimes they start to bald in the temple area, up here. The treatment for pattern baldness, one of the treatments is called minoxidil, and the brand name is Rogaine. Minoxidil is a synthetic drug that is a vasodilator. That's just a fancy word for it widens the blood vessels. I never recommend this to anybody until I tell them to go to their doctor first, because when you have any kind of synthetic drug, even that you're putting on your skin or taking orally, you have to make sure it doesn't interact with other medications that you are taking. So please, if you are curious about minoxidil or Rogaine, even if you can get it on Amazon, talk to your doctor first. It's important that you go through them to see if it would be something that would be safe for you to take. Minoxidil takes about 12 weeks to see the hair growth, and you will have to use it for a long period of time. So it's not something that you just take once and then it's fixed. So that's something you have to consider as well, if it's worth it for you. Another thing is hair transplants. And a long time ago they were called hair plugs. They've come a long way with their technology. It looks more realistic. Now you'll spend anywhere from $5,000 to $25,000 for hair transplants. And it's a very painful process. It's done under local anesthesia, and they'll take portions and sections of denser areas of follicles and place them where the follicles are less dense. Now we're going to go over other causes of hair loss and treatments. So stress is another factor for hair thinning and hair loss, and we have a lot of that these days, especially in this time that we're living in. Another cause for hair thinning and hair loss is anesthesia and medication. This particular type of hair loss is called telogen effluvium. The telogen phase can last up to 3 months. So after anesthesia, remember, it'll take about 3 months for your hair to start growing back and getting back to its normal state. Another reason for hair thinning and hair loss is a hormonal imbalance. A lot of women that become pregnant notice that their hair is the most luscious, luxurious, and thickest it's ever been. And the reason why is because when you're pregnant, your blood volume doubles. So after you have the baby and your hormones start to go back into their regular phases, a lot of women will notice that they have a lot of hair loss. So that's another reason for hair loss, is the hormones just going back into place and the hormone imbalances. Malnutrition is another cause of hair thinning and hair loss in young and middle-aged women. A lot of times you can have anemia. Anemia is low blood iron. And what happens is when somebody becomes anemic, the oxygen from the body goes to the important organs. So it takes away from the least important things like your hair and things like that. It'll take that oxygen in the blood and put it where it needs to be: your heart, your brain, your lungs, your liver. Get your blood work done. See a doctor if you think it could be malnutrition. Another thing is vitamin D. There's studies that are showing that a lack of vitamin D can cause hair thinning and hair loss. And also dehydration. It's important to stay hydrated. So talk to a nutritionist, a registered dietitian, or a doctor who's educated in that area, and they can help you get on the right path to good, wholesome food and proper nutrition. Another reason for hair loss, and I don't know if you remember from years ago, there was a product called Wen that was out on the market, and it was all the rage. It was a cleansing cream. The problem with this product, people kept using it and using it and using it. However, there was nothing that cleaned their scalp. So they had product buildup so bad from not having any surfactants like a shampoo has that cuts that grease and gets rid of all that sebum and dirt and product buildup. So what happened is the product built up on their scalp so much to the point where it suffocated all the follicles, and these women were complaining of major hair falling out. Fortunately, product buildup is a simple fix if you catch it in time. So it's Paul Mitchell Tea Tree Hair and Scalp Treatment. And it smells amazing, it feels amazing, and it will cleanse your scalp and get all of that debris and all that residue and all that buildup off so that your follicles can breathe and that your hair can have a nice oxygenated area to grow. Learning these things and knowing what to look for is really important in your hair health. So thanks for watching, and thanks for subscribing. Share it with a friend, and hopefully if you forget, you can always refer back to my videos and they'll be there for you on YouTube. So thanks again.